By the time an individual gets to see an endocrinologist, many months have elapsed. We did a project where we had patients, they would first go to a local pharmacy and would get a free sample for a continuous glucose monitoring device. So we're talking about a blood sugar reading that's taken every minute. Fast forward to 2-3 weeks later when they get to see me at my appointment. Using that information, I can make a judgment call on what medication they would perhaps benefit from using, what lifestyle modifications that we can incorporate at this time. And we showed that just by virtue of having this additional appointment, we're able to reduce their average of blood sugar readings because we are now getting patients better glycemic control, better sugar control at an earlier stage. Their follow-up appointments with the endocrinologist don't need to be that frequent, which then frees up our time to see more patients. So when we started this project, we were able to bring down the wait time for seeing an endocrinologist from initially it was about 9 to 12 months for non-urgent cases, and now we brought that down to 6 months.
He is a dynamic individual. He is very dedicated, very keen, and in a very short space and time, he has contributed so significantly.
As an endocrinologist, I do manage individuals that have poor bone strength or weaker bones. Treatment for management of prostate cancer, unfortunately, one of the side effects of these hormone injections is that the bones become extremely weak. So we put together this program where all the high-risk patients that they would identify in their cancer practices would be referred to my clinic. So that's when we started partnering with the pharmacy. The pharmacists are now able to do the injections for these individuals on a monthly basis. Previously, the wait time for seeing these individuals with cancer who are having bone issues was almost 6 to 8 months, and now we've cut it down to about 2.5 months.
It's quite innovative for Dr. Jain to kind of see the needs of his population of patients, but also to be able to identify and leverage pre-existing community resources.
I strongly feel that all of us have our fortes, and pharmacists are so helpful in the management of all these different aspects of healthcare that we would be amiss if we don't use them.
Because of Dr. Jain's innovative work, he has done a tremendous amount to help knock down the barriers to accessing care that a lot of the patients have in this patient population.
The fact that I can be there in the best of my capacity and make a difference, a small difference at that, but something that would allow them to perhaps not have a fracture and be able to play with their grandchildren, or not have a kidney deterioration because of diabetes and live a long, healthy, fruitful life. To know that I'm able to make a little bit of a difference in that gives me the inspiration.